What are cold weather-related injury? Definition: cold weather-related injury refers to any injury or condition that is caused by exposure to cold temperatures. These injuries can range from minor discomfort to life-threatening conditions. They can affect the skin, muscles, nerves, and internal organs. Steps of cold injury? The steps of cold injury include: 1. Initial freezing of tissues, which can cause damage to cells and blood vessels. 2. Inflammation and swelling in the affected area. 3. Development of frostbite, which can lead to tissue death and necrosis. 4. Rewarming of the affected area, which can cause further damage and inflammation. 5. Development of complications such as infection, tissue death, and amputation, in severe cases. Causes of cold-related injury. 1. Frostbite occurs when the skin and underlying tissues freeze. It is most common in the fingers, toes, nose, and ears. 2. Hypothermia occurs when the body's core temperature drops below normal. This can be caused by prolonged exposure to cold temperatures or by getting wet in cold weather. 3. Trench foot occurs when the feet are exposed to cold and wet conditions for an extended period of time. It can lead to numbness, tingling, and eventually tissue death. 4. Chilblains occurs when the skin becomes red, itchy, and swollen after exposure to cold temperatures. 5. Snow blindness occurs when the eyes become irritated and inflamed from exposure to UV rays reflecting off snow or ice. Prevention of cold-related injury includes dressing warmly, staying dry, keeping active, and avoiding alcohol. It is also important to be aware of the signs and symptoms of cold-related injuries so that treatment can be sought quickly if needed. Prevention and treatment of cold-related injuries? Cold weather injuries can be prevented by dressing in warm, layered clothing, staying dry, and staying active to increase blood flow. If you do get cold, it is important to rewarm the affected area slowly and seek medical attention if there is any sign of frostbite or hypothermia. In case of frostbite, rewarming the affected area slowly and carefully, taking pain medication, and in some cases, surgery may be necessary. Hypothermia can be treated with gradual rewarming, either through external means such as warm blankets or immersion in warm water, or internal rewarming using warm intravenous fluids. It is important to seek medical attention as soon as possible if you suspect you or someone else may have hypothermia.